hopefully this will go well. I've never really done it a lot before. Okay. So the response to COVID has been cruel and inhumane. The restriction on people's freedoms in and outside of nursing homes and long-term care facilities is unprecedented and a violation of human rights. My name is Twila Brase. I'm president and co-founder of Citizens Council for Health Freedom, a national patient-centered healthcare policy organization located here. We fight for patient and doctor freedom and the right of every American to patient privacy, which is foundational to having freedom. So COVID-19 is a serious disease for those who get a severe case. But what if the truth about cases, deaths, and infection is something quite different than what we've been told? So 4 facts that put the lockdown into question. The continued lockdowns on access to facilities, access to fresh air, access to individual freedom is predicated on the spread of COVID-19. It's predicated on government reported case numbers, death numbers, and testing. First, so let's look at that. First, according to the New York Times study of positive cases in 3 states, up to 90% of the positives are probably negatives because the processing of the PCR nasal swab test is being done wrong by the labs. What labs are finding often isn't enough to infect the person or for that person to infect anybody else. Second, the CDC encouraged doctors and others to add COVID as a cause of death, even though it's not believed or known to be the cause. Third, the CDC told states to include probable cases and probable deaths in the number of confirmed cases and confirmed deaths, inflating those numbers. Fourth, the number of cases is rising because testing is increasing. But doctors tell me that a case is not a case unless the person is actually sick. So this whole thing of counting cases that people are asymptomatic and just have a positive test but no symptoms is very different than what they've ever done in the past. So imagine now what would happen to our numbers of seasonal flu if we tested everybody during the flu season for seasonal flu. What would that do? What would that do to our numbers, right? So going on this kind of fishing expedition for cases that likely aren't cases is costly in dollars, in freedom, in health, and in human lives. So here's just one example before I get to nursing homes specifically. I was on the street and I experienced an accident. It was really a very simple accident, but the woman got a laceration. And I told her, I'm an emergency room nurse, I said, you need to get stitches. And she said, no, I can't go to the hospital because of COVID. She's got blood dripping everywhere. I said, no, you have to go. But see, this is the fear that people have about the hospital. But this is actually small potatoes compared to the COVID deaths coming solely because of the response to COVID, not COVID itself. Some have called these reaction fatalities. People have died or will die unnecessarily from cancers, quietly progressing from one stage to the next without diagnosis or treatment. Known cancers are being left untreated. People with emergency conditions are waiting too long to seek care. Child and domestic abuse are on the increase. Despair and desperation are leading to depression and increase in suicide. And the feeling of abandonment felt by the elderly stranded in their rooms. They are left to live, eat, and die alone way too often. So I believe that this tragedy is going to be one of the lasting and terrible legacies, not of COVID-19, but of the response to COVID-19. It's been 219 days since the emergency was declared on March 13th. The governor has maintained his executive power because the courts refused to acknowledge the usurpation of the legislature. And the Minnesota House leadership is happy to let the governor maintain his one-man rule and refuses to stop a governor gone rogue. So just a little bit of timeline regarding nursing homes. March 13th, the executive order. Compassionate care, just so that you know, this compassionate care has been available the entire time, but that doesn't mean that people can easily get it in their nursing home facility. On July 25th, One essential caregiver for 3 hours per visit per day was allowed by the guidance. On August 29th, visits by friends and families, if no COVID exposures for the past 28 days. And just yesterday, visit by friends and families if no COVID exposures in facility for the past 14 days. But here's the thing, this is only guidance. It's only guidance. It's not law. They don't have to choose to do it. And so some facilities don't follow this at all. So they're not even opening when they could open more. So nursing homes and long-term care facilities have set their own policies, keeping family and friends out no matter what. Now here's a verbiage from the Minnesota Department of Health, which I thought was really interesting, and I'm quoting them. Current federal and state government guidelines provide direction to restrict visitors and volunteers who want to visit the facility. This includes family and friends. Now mind you, I said guidance, right? Federal and state government guidelines. This restriction is in effect until further notice in order to help stop the spread of COVID. So it went from guidelines to restriction by the health department. And that's an important thing for you to understand. So how many people have died because of the restrictions rather than COVID or old age? How many of our longest lived citizens have been maltreated, abused, left without food, unwashed, poorly clothed, without a single family member allowed in to stop the abuse or to bring accountability to the lack of care? According to the health department, and this is right out of one of their documents, the number of maltreatment reports coming in since March has dropped by 20% compared to a similar period from 2019, a drop that would not be expected to have happened by coincidence during a major pandemic, end quote. So you can tell that even the health department knows that they would expect to be receiving more reports of maltreatment in the nursing homes. The Office of Ombudsman, according to the health department, says it's been dealing with many calls from residents who feel hopeless and helpless, stuck inside facilities, cut off from family and friends, and from family members who worry about the health and safety of their loved ones, end quote. That's also from a health department document. So now, whether in-person visits are allowed is determined by the percent of COVID-19 cases that come back positive over the number of tests performed in a county. So what if 90% of those positive tests are really negative? How many people are being deprived of access to their family members and will continue to be deprived because the PCR test is being used, or because it's being done incorrectly, because a lot of people who are claimed to be positive aren't? 2,217 deaths as of yesterday. The question you should ask is, are those with COVID or are those from COVID? Yeah. And we don't actually know. So I want to tell you what the director of the Illinois Department of Health is quoted on a video saying when she was asked by journalists, is it a COVID death? She said, if you were in hospice and had already been given a few weeks to live, and then you were also found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone listed as a COVID death doesn't mean that that was the cause of the death, but that they had COVID at the time of the death. So at the end of the day, we don't actually know what the statistics are. We don't know what they are about cases. We don't know what they are about testing. We don't know what they are about deaths. But everything is being predicated, and the elderly are being stuck in their rooms and in their facilities without access to care, and without access to their family as a result. And in Sweden, just as an interesting example of a study, they found that only 59% of patients dying with someone, there were only 59% of patients dying with someone present this year versus 83% last year. And only 13% of the time in nursing homes was that a family member. So this is not only happening in the United States, but it's happening all around the world, that people are being deprived. Two more things before I'm done here. I think a question that should be asked is, how is it that staff can go into the facility from their lives, in and around stores and people and all sorts of other things, right? But the family cannot come. How is that? And then why does the health department allow facility staff to come to work in the facility after they've been exposed to COVID-19 when they would tell the rest of us to quarantine? There are so many double standards here, and the elderly are suffering as a result. All right, so the last thing I have to say is the Great Barrington Declaration. If you haven't looked it up, please do. It's written by epidemiology and public health experts around the world. And they call for the lockdowns to be lifted, the young to go back to normal lives, and the lives of the vulnerable to be protected. And they say it is voluntary for those at risk to decide how much of life they want to participate in. And so they are calling for something very different than is happening today, and they're just really saying that the elderly can bear the risk. Let the elderly bear the risk. Here they are in their last days of their lives, and we're depriving them of the things that are most precious to them. So this is cruel. This is inhumane. The October 2nd guidance says, due to the risk of exposure, holding hands and kissing is not allowed during visits. So this is the final days of their life, and it's got to stop, and it can't be allowed to happen again. Thank you.